Hi, and welcome to Hill and Ponton's Veterans Disability Blog. I'm Natalia Jofre, the company COO.
And I'm attorney Melanie Williams.
And as you can see, we're doing things a little bit differently now. We are adjusting to the times and trying to do our part in staying safe and keeping others healthy. We're happy to report that everyone here in our office is doing well. So far, so good. And we do want to let people know that obviously we're still open, we're still working, we're actively working on veterans disability claims, and we didn't want to stop the flow of information. And so for that reason, we have found this new, innovative, wonderful way to continue to do these blogs and continue to communicate this important information to people. So, Melanie, we're going to do our usual interview. And today we're going to be talking about VA disability benefits for diabetes.
Yes.
And we obviously hear about a lot of veterans that have diabetes. And I guess let's start with the basics. There's two types. What is type 1 diabetes?
Yes. So type 1 diabetes is insulin-dependent diabetes. It's also called juvenile diabetes because it tends to be more common in children. It's a genetic condition, so there's nothing that you can do to prevent it. And it's basically when the body is not producing insulin. And so that's why it's insulin dependent.
And you can obviously, a lot of children are, not a lot of children are diagnosed with it, but a lot of times it's diagnosed, like you said, when the person's a child, but then you can carry it into adulthood, right?
Right. Yes. It's usually it's a chronic condition. So once you're diagnosed, it just kind of continues.
Stays with you. And then what is type 2 diabetes?
Type 2 diabetes is the more common that we see among veterans. It's also called adult onset diabetes, and it's basically when the body isn't producing enough insulin or the body is resistant to insulin.
Okay, so hence begs the question, does the VA give benefits for type 1 or type 2 diabetes only?
No, so you can get service connected for both conditions. So type 1 diabetes, we mentioned that a lot of times it starts in childhood, but it is possible for it to have started in service. So just like any other condition, if it started in service, you can get service connected for it. So, if you're diagnosed in service, if you start showing symptoms, and if you're diagnosed within a year after your discharge, because it's a chronic condition, you can also be service connected that way.
Okay. So how do you get service connection for the diabetes?
Well, you would file service connection like anything else. And then, because there are the three elements that you need to establish: the current condition, the in-service incident or event, and then the nexus between the two. But if it started in service, that already suffices to show the connection that it started in service.
Okay. I heard that some medications can lead you to have type 2 diabetes. So a couple of questions there. Is it true? And can you get VA disability benefits for this?
Yes, absolutely. So type 2 diabetes is, the more common one, as we mentioned, and there are different ways that it can be developed. So we did mention, it being developed in service, but it's also possible that it could be secondary service connected. So if you have a condition that is already service connected, diabetes results from that condition, it can be service connected. So like you said, the medication, there are certain medications that cause diabetes. So one example is corticosteroids. If high dosages of that, or when you're on that for a long period of time, that causes diabetes. Conditions that you usually take corticosteroids would be for asthma or arthritis. So if you're service connected for either of those, you're taking corticosteroids for them, and then it develops into diabetes, you can be service connected for the diabetes.
Wow, I would have never thought of that. Okay.
Yes, there are other medications as well. So beta blockers help reduce blood pressure. So if you're service connected for hypertension, and you are on beta blockers and that causes diabetes, you can be service connected that way. Also, statins lower cholesterol. Higher doses of it means higher risk for diabetes. And same thing as antipsychotic medications used for schizophrenia. So if you're service connected for schizophrenia on medication, you develop diabetes, you can get service connected that way.
Well, you just answered a question I've had for a really long time, because when I did Social Security disability claims, I often had clients that had hypertension and diabetes. Almost, I mean, like 90% of the time they had
Yeah,
both.
yeah,
And so now I understand why. Sometimes it was the actual medication was causing them to have the diabetes.
right.
Wow, that's interesting. Are there other disabilities or conditions that can occur because of suffering from diabetes?
Absolutely. So, unfortunately, diabetes is one of those conditions that causes a lot of complications. And so,
Hmm.
just like we talked about secondary service connection, you can, if you're then service connected for diabetes, you can be service connected on a secondary basis for its complications. So, for example, heart conditions.
Hmm.
Diabetes tends to cause heart disease, stroke, hypertension, atherosclerosis. We've also talked a lot about peripheral neuropathy. So, when you get
Yes.
the numbness and tingling and the pain in your hands and your feet. Basically, diabetes causes nerve damage. So
Hmm.
you can be service connected for peripheral neuropathy. Secondary to that, there's also erectile dysfunction, kidney damage, eye damage, so like cataracts, glaucoma, retinopathy. Those are all also conditions. And something that tends to be forgotten is diabetes causes slow healing of wounds. So if you have
Yes.
a cut or a wound, it could lead to infection, it could lead to severe damage, and ultimately amputation.
Hmm.
The VA has said that diabetes is one of the leading causes of amputation among veterans.
Wow.
And so, amputation is something you could get special monthly compensation for. Um, and sleep apnea is also a really common condition that develops due to diabetes.
Hmm.
So there's a lot to consider if you have diabetes and all of the resulting conditions. There's a lot that you
Right.
can be service connected for.
It's like a Pandora's box of just horrible disabilities you can have as a result.
Yes,
So just to clarify, you can get it for for the diabetes, but then you can also qualify for secondary conditions too. One of
yes,
the
exactly.
conditions that you mentioned that I want you to maybe expand a little bit more on, because sometimes people know how they feel, but they don't realize that that's what it is,
Hmm.
which is the peripheral neuropathy. I mean, in a
Yes.
heart condition, you go in, the doctor says this is what you have.
Hmm.
Obviously, if you need to have an amputation, wow, that is severe. And, clearly you've failed wound care. I mean, now we see wound care clinics and everything else. But with the peripheral neuropathy, I think that sometimes people don't realize that the way they're feeling isn't normal and they forget to talk to their doctor about it. So, can you explain a little bit more what peripheral neuropathy is and maybe what the person may be feeling?
Yes, absolutely. So a lot of times it's described as like a pins and needles sensation. It
Mm-hmm.
usually starts in the fingers, the hands, in the feet, in the periphery limbs. There's pain associated with it. It also leads to numbness, and it may not be a constant pain, a constant feeling. It may start as just occasionally here and there, and then increase in severity and increase in frequency. And so
Mm-hmm.
you'll definitely want to tell your doctor about that. And they have sensory tests that they can do
Mm-hmm.
to measure, how much the nerves can feel. They can diagnose you with it and measure the severity of it. And then that would determine the rating that you would get for the neuropathy.
Okay, great. So, speaking of the claim, what evidence is helpful to prove your disability claim for diabetes?
Yes, medical evidence. So
Mm-hmm.
you'll want to go to your doctor, make sure that you have an actual diagnosis of diabetes. And then to get rated for the diabetes, you'll also want a doctor's evaluation. So there's something called a disability benefits questionnaire.
Mm-hmm.
You can find the form online, you can have your doctor fill it out. And that would be how you can establish your rating. So to go over the rating for diabetes, a 10% rating is basically if you can manage it with just a restricted diet. 20% rating is if you need insulin and a restricted diet or medication like metformin. A lot of
Mhm.
veterans are on metformin with a restricted diet. And then 40% is if you are on all of those insulin restricted diet and a regulation of activities. So if your doctor says you shouldn't be, exercising because it could decrease your blood sugar levels, or that you should be, that you need to have a certain regimen, that would warrant a 40% rating. 60% rating is the same as above, but when you require hospitalization or visiting your doctor twice a month. And then 100% rating you can get for diabetes if you have all of the above, as well as 3 visits to a hospital or a weekly visit to a doctor, plus loss of weight, loss of strength, and all the complications that we've talked about. So those are all, very objective uh,
Mhm.
criteria. And so you'll want to make sure that a doctor is the one commenting and determining what's required in order to manage your diabetes. That's what the rating is
Right.
based on.
Okay. I want to go back a little bit to the hospitalizations because you
Mhm.
mentioned starting with 60% and up. So I just want to clarify this doesn't mean that you need to be in the hospital on an ongoing basis, right? I mean, do you have to be internally admitted or in a nursing home or something to that effect? Or can it be just frequent visits?
So there are certain conditions that require hospitalization. So it's called ketoacidosis.
Uh-huh.
So when it becomes severe enough that you need a hospital intervention. Same thing like if you have hypoglycemic episodes that require that hospital intervention. That would be if it's once or twice in a year. If it's that would be the frequency or severity that they're talking about.
Okay. Okay, great. Any common issues with diabetes claims? Because we know that, well, nothing's easy when it comes to the VA, but are there any specific issues that you've seen with diabetes claims?
Yeah, so the most common issue that comes up with specifically type 2 diabetes and improving it is that it is a presumptive condition for exposure to Agent Orange. So if it has been established that you were exposed to Agent Orange, you don't have to prove that your diabetes came from that exposure. It's already uh, established, it's already been proven, so it's presumptive. Um, the problem tends to come in where you have to prove that exposure to Agent Orange,
Right.
because there are 2 different presumptions. One is if you were in Vietnam, you are
Mhm.
presumed exposed. The second is when you have proven exposure, you're presumed service connected for diabetes. Um,
That's huge. So let's slow down and emphasize on that for a second.
yes,
So if you can prove that you were in Vietnam, right, during your service period, you are automatically presumed to have been exposed to Agent Orange. That is no longer a question. Is that
right,
correct?
right. As long as it's in that certain time period.
Right.
Yeah, mhm,
During what is considered to be wartime.
yeah,
And then you if you were in Vietnam during a certain period, it's presumed that you were exposed to Agent Orange. And therefore, if you now have type 2 diabetes, automatic link, right?
correct. Hmm.
Automatic link to I have diabetes and I should be able to get service connection for the diabetes because I was in Vietnam.
Yes, exactly.
Wow. Okay. I think that's huge. People
It
need to
is.
understand that that is, I mean, that's helpful, incredibly
Absolutely,
helpful.
absolutely.
Okay.
And so a lot of times, the issue comes in. There are there's a presumption for when you were exposed to Agent Orange, but
Uh-huh.
you can still prove that you were exposed to Agent Orange in other ways, even if you weren't specifically in Vietnam during that period of time.
Right.
So again, as long as you're able to prove exposure, service connection for type 2 diabetes is conceded.
Okay. Are there other ways that, well, I'm sure there's other ways to establish, right, that you were exposed or that you were in Vietnam or, if it were easy, everybody would be on benefits, but it's not easy, and the VA doesn't always do what it's supposed to. So there are other ways, though, to prove, right, that you were there or that there's service connection.
Right, exactly. There's the Blue Water Vets. That's the new case that came out. Showing that if you were within the 12 nautical miles of Vietnam, you're presumed exposed. But same thing in Korea if you were along the DMZ, in Thailand if you were on certain bases. But a lot of times you may not fit very clearly into the box that the VA wants you to fit in. It
Right.
doesn't mean all hope is lost. There are still other ways that you can, and that's something that our firm works on a lot is showing the different ways that a veteran could have been exposed, even if they don't specifically meet those requirements.
I'm really glad that you mentioned that because we do get a lot of calls and a lot of very frustrated veterans because they say, no, I wasn't in Vietnam, but I was in Thailand and I was in Korea and I was there and I was exposed. I mean, I read some of these emails and it's jarring, how they would sit on top of the barrels of
Yes,
Agent Orange
yes,
and have their lunch and they're not getting benefits and
right,
they have all sorts of cancers and nobody will believe them.
right.
So that is in our area of expertise as well, is proving those claims, right? Even
Yeah,
if you don't check the right box.
right, right. So yeah, that's why, I don't want veterans to be discouraged if they haven't been presumed exposed. It doesn't mean all hope is lost. You can
Okay,
still
great.
get service connected for diabetes.
Wonderful. Anything else you want to add?
No, I think we covered
I
it.
think you covered it all. Well, this was great, Melanie. Thank you so much.
Thank
Um,
you.
On behalf of all of us here at Hill and Ponton, we wish you and yours all the best and the best of health. And if you have any questions, please feel free to visit our website or call our office because we are still open. Yep. All right. Thank you.
Thank you.